Numbers of COVID-19 patients are pushing Kansas City hospitals to a breaking point.
So at some level, we're beginning to say, well, we can take care of these folks, but that means we can't take care of those folks.
And here are the numbers that have hospitals so concerned. 1 week ago, the University of Kansas Health System had 40 people hospitalized for treatment of COVID-19. 16 of those were in the ICU, and another 33 people there were still recovering in hospital beds. But the numbers as of today, look at the jump right there. 72 people hospitalized in the ICU, now 26, recovering 36 people. And it's the same story at many local hospitals. And Brad, this crunch is not just coming from here in Kansas City.
Yeah, it is not, Ellen. Smaller rural hospitals simply just don't have the beds and the staff to handle all the patients that they're seeing. That's why those people are getting transferred to Kansas City hospitals. And the situation is so bad in Lexington, Missouri, about 50 miles east of Kansas City, that the fire chief is literally pleading with people. In this Facebook post, he says, folks, this COVID issue is getting out of hand in Lexington. Our ambulances are running multiple cases a week to the city. KCTV5 stands for you. We sent KCTV5's Leslie Aguilar to Lexington to find out about the situation there and the larger impact.
Right now, Lafayette County has 29 recorded COVID deaths and 1,084 cases. That may not seem like a lot, but it's putting a strain on resources here, and the numbers keep going up. The Lexington, Missouri Fire Department usually only has 2 people on duty running emergency calls. Multiple hour-long trips a week transporting COVID patients from the small local hospital to Kansas City drains the town's emergency resources.
Some people don't agree with us. You know, they think we're blowing this all out of proportion, but let me tell you, it doesn't feel good if you happen to get it.
We had to speak with Fire Chief Brad Weber via Zoom because he has COVID symptoms and is awaiting test results at home.
I have transported a couple of patients that they didn't think were COVID and ended up being COVID. So I'm thinking that's probably what happened to me.
Lafayette County's mask order expired in September. Chief Weber thinks that's part of the reason cases are on the rise. But
I cannot correlate that because during those 2 months, the cases continued to escalate while we had the mask order.
County Health Director Tom Emerson says most of the cases seem to originate from private gatherings.
Parties, weddings, family get-togethers, when people from different households come together. And I know it's the time of year when we do that, but I'm just saying that's where we're seeing most of our clusters and spread.
In downtown Lexington, more people seem to be masked up than not. Noble Green is among many concerned with the rising case numbers in rural counties.
I just think the people are kind of acting like they're invincible, you know, and it's just the flu, and I don't believe that.
Brian Hughes is not concerned whatsoever.
It's just another form of the flu.
Both men feel differently about the upcoming holidays.
Our whole family will be together, and we'll just go on.
We're not having any kind of celebration at all, even over Christmas. We're just going to celebrate ourselves, you know.
Health officials and emergency personnel urge people to take precaution and not gather to keep people safe.
Right now, we are hurting. We need people to just think about each other.
Please, everyone, just follow the same simple recommendations we've been talking about since April.
For the first 9 days of September, the county recorded just 38 cases. For that same time frame in October, 102. And so far this month, 179. So the cases are snowballing, and many of those patients are ending up in Kansas City, where hospitals are on the brink of reaching capacity. Something to think about next time you consider going out. Leslie Aguilar, KCTV5 News.